show the other providers how to check babies when they see them in their office. Okay, so typically what I recommend, baby laying down like this, you come from behind. It's best if you have a light so you can see, visualize everything much better in the mouth. I typically have the parents hold their hands down here by the side of the baby, just so they don't bring their hands up to push me away. And then once that's happened, this is my baby, I don't have anyone else holding him, so we're gonna try this here. So what I typically do is lift the lip up so I can check the areas like this, and I'm gonna see where the lip attaches on the gum area, how far down. I'm also gonna note how the lip attaches to the under surface of the lip, the wet part of it, and what percentage of the wet part of the lip is being held down by the tie. I'm also gonna check the cheek ties. I'm gonna come here, and whether they're present or absent, I will let the assistant know and the parents are present when we're going over the findings. And then I'm gonna check the one on the side over here. It's good to check the tension for the cheeks also. Sometimes babies just feel very, very tight and tense. Most of the time they feel soft and stretchy like this. I can easily move the cheeks up and down and side to side. Then I'll go to the lip side on the bottom arch, and that one's very minor one there. And then I'll finally move under the tongue. So I'll bring my fingers under the tongue, lift it up. I typically push right here with my middle finger, so that way I can visualize the area better. And what I'll do is I'll just sit here and hold the tongue up and let the baby move their mouth. Most of the time they're crying, and that's exactly what we want them to do, so they can show us more of the tie. And you can see Rafa, even though he has been revised, there's some scar tissue there, some little contraction. He still has a little bit of a tie there, but his function is way better after his revisions. But this is what I'll do. I'll hold the tongue up and just let them move their mouth. If they cry, it's even better, because especially if there's a posterior tie, it'll appear way, way better for you to visualize. Then I take my finger and feel the area, palpate up and down and side to side, and see if I feel anything bumpy there or if it feels nice and smooth. And the last thing I'll do is I'll come over here and I'll check the roof of the mouth to see if it's like a nice arch, or if it's round, if it's higher than normal. And then you can describe it, because that also has an impact on the breastfeeding and the latch. So I'll typically discuss that with the parents as well. And then that's usually it for the exam part. I hope this is helpful.